This is Outbreak News This Week, brought to you by the Global Dispatch Incorporated. Outbreak News This Week is your source for all the news about worms and germs. And now, your host, microbiologist and editor of OutbreakNewsToday.com. Here's Robert Harriman.
Well, good evening, Tampa Bay, and those listening online. My name is Robert Harriman, and this is your source for all the news about worms and germs. This is Outbreak News This Week. And I'd like to say Merry Christmas while I got your attention today. Well, I've been trying to get my next guest to come on the show since, September. But he's a really, really busy guy, and we've gone back and forth trying to find time conducive to both of us. And it turned out it was the Christmas break. But I believe you'll see that it was well worth the wait. Joining me now to talk about the medical laboratory science profession, some current issues, and how the future looks is Dr. Rodney Rohde. Dr. Rohde is a professor and program chair for the Clinical Laboratory Science program at Texas State University in San Marcos. Dr. Rohde, welcome, sir, to the show.
Hi, Robert. Thank you so much for having me on. I've been looking forward to this opportunity for some time.
Yes, sir. As have I. Today's show is going to be a little bit different. It's not going to be so much about infectious disease news, but we're going to talk about a profession in which part of their job is dealing with infectious diseases. Part of the job is testing for non-infectious diseases, non-communicable diseases like glucose and sickle cell and other types of tests. So Dr. Rohde's got a wealth of information, a wealth of knowledge in this topic. So let's take a look at it. And Dr. Rohde, this profession goes by, has gone through a lot of changes as far as the names. I used to be medical technologist and clinical laboratory scientist. I think most currently is medical laboratory scientist. But to jumble it all together into a ball, let's say, what is a medical laboratory professional?
That's a great introduction to our profession, Robert. Mm-hmm. It certainly has changed over decades now, and you just went through the variety of titles. Generally, when I'm talking about it, I do try to utilize, especially in the last several years, I've tried to force myself to use the term medical laboratory professional because we are very diverse across a variety of degrees and credentials. But let me give you just a quick kind of snapshot of what we do. Medical laboratory professionals are really the individuals who work primarily in hospital laboratories. They do the bulk of laboratory testing to help diagnose disease and other illnesses in patient populations. And as you mentioned, it's not only infectious disease, it's also inherited disorders and other types of situations around your health status of different patients. While most of us work in the hospital environment, others may work in public health labs across the country. You may find us in research laboratories and even in other clinical and medical-related fields. For instance, some of our graduates and others, after working on the bench for a while, maybe longer, they will steer into a different direction where they may become a corporate person that is the individuals that go in and inspect laboratories to make sure everything's going well, or even in sales or implementing new equipment into the hospital labs and others.
Yeah, it really does expand out, or education as in yourself.
Absolutely, yeah. Absolutely, and that's a critical area that hopefully we'll have a chance to talk about today, both in the health arena and in the training and educating of those health professionals. Okay,
so the medical laboratory professional, we can kind of break it down into the medical laboratory scientist and the medical laboratory technician, and we'll go over education differences momentarily. But
sure,
the typical day, the run-of-the-mill day.
You bet.
What is a medical laboratory professional doing?
Well, we're doing a little bit of everything. We're a jack of all trades. Sometimes people even kind of utilize a cook with all the different things they have to do and keep running with our profession. One of the quick things about us is that sometimes is not well known, maybe so kind of at some level, but not always in the details, is that, hospitals never close. So the typical professional in our field will work some type of shift in a hospital environment. And then if you're in one of those other settings like public health, you may have a more regular schedule. But let me focus on the primary environment of the hospital to kind of give our listeners a snapshot again of what we do in these very diverse and complex field of medical lab testing. For example, you may find us typing and screening the blood that may be needed in some urgent massive trauma like an automobile accident patient. That could be, a variety of situations around those types of trauma. Or you may find us utilizing different assays and algorithms to differentially test and identify things like antibiotic-resistant microbes or other pathogens. And then that goes hand in hand with the all-important antibiotic susceptibility test that we can predict the correct drug for a patient to utilize. Or we may be running some type of specialized hematology test like a CBC to determine whether or not a person has a rare or common form of cancer or some other blood disorder. We may be running clinical chemistry panels for your liver function, your cholesterol screening, or your prostate-specific antigen. And then on top of all of that, and that's just a few of those types of tests, we'll talk more about that later perhaps, but we're the ones in the medical laboratory that are trained and educated to do the critical and necessary quality control and assurances of all those tests and all those panels of different algorithms and automated equipment so that we know and later the doctor knows that that test can be trusted, it's accurate and true to describe your condition. And really the last point to make on this topic is that really what makes us unique and different, I would say, from a kind of a regular science or bio major is that really no other major prepares you kind of for this intense, fast-paced, and very complex world in the medical lab as it relates to creating a diagnosis. There's so many things in this area that's kind of difficult to cover it all, but certainly it is one that is very rewarding and very rigorous in preparing for that type of career.
Yeah. And so just to break it down for the audience a little bit, so somebody that is a medical laboratory professional, they're going to have intense training in a variety of scientific disciplines, chemistry, microbiology, immunology, blood banking, hematology, and a few others. And I know, people listening in the audience, what they may know about somebody in the laboratory is they know they go to their doctor's office, they have their blood drawn, and it goes off to LabCorp or Quest, and then they never see anything about it again. So, so I just wanted to put that picture out there that there's really a lot going on here. It's not just somebody drawing the blood and giving it to a courier and going across town.
There really is. It's interesting that you mentioned that too, because those large reference labs, which we do rely on, like LabCorp and Quest and Sonic reference labs and others, mm-hmm. They're a vital part of our profession as far as hiring and utilizing our graduates. But within that internal environment of the hospital, you also have a lot of these high-level complex tests, going on because many of them are stat, right. And you can't wait, a day or half a day to get those tests turned around.
Now,
but we're all working together to provide that data.
That's right. Now, the doctor is ordering these lab tests, and in fact, I've read that lab results are probably the most used and important information that physicians actually use in treatment and diagnosis and all that. And I take it that's true, correct, Dr. Rohde?
Absolutely.
Can you back that up with anything?
I can. That's very factual, and it's absolutely true in our world. Most research shows that medical laboratory professionals provide up to approximately, depending on the sources you look at, but it's roughly around 70% of the patient's laboratory testing. We provide that to physicians so that they can provide an accurate diagnosis and a treatment plan. There's several studies. One that I use quite often is a 2002 study in clinical leadership and management review. It's called The Value of the Laboratory Professional in the Continuum of Care. And actually in that study, the author, Rodney Rohde, who's Director Emeritus of the Mayo Clinical Lab, talks about 94% actually of the objective medical data in a patient record comes from the laboratory. So pretty important stuff. And if you start looking at the fact that about 7.25 billion laboratory tests are conducted in the United States, according to the Centers for Medicare and Medicaid Service, you'll kind of see why our graduates and our professionals are so critical and yet sometimes not understood in the general public and even sometimes within the healthcare setting. So we're trying to work very hard to change that.
Right. So that's big. So you said about 70%. So that means the remaining 30% is symptomology.
Correct. Yeah. I mean,
yeah. So
and I do want to state here, I do this often, that certainly physicians, nursing, physical therapists, all the healthcare team, they're noble professions, they're valuable, right. And that's always something we're going to promote. We just feel like the piece around medical laboratory testing is not understood, and we want to make sure people understand that component of their healthcare.
Very good. All right, I concur with that that point. Now let's talk about the education. This is something in and out. So, what kind of education is required for the different categories of medical laboratory professionals? And can you talk a little bit about the coursework? And you can even go into your own program at Texas State.
Sure. And I'm just going to start talking here, so feel free to stop me and clarify if you need. It is a very diverse and kind of complicated area because there are different paths and different ways to do this. But let me kind of just hit the big points, and we'll kind of see how it goes from there. There are several paths for a medical laboratory professional. The entry level is typically referred to as the medical laboratory technician. It's a MLT, and that's an associate's degree level, so you can do it in a couple of years. And once you get that associate's degree as an MLT, typically you will sit for the MLT credential, and we can talk about those credentials down the road. Mm-hmm. Following that, and probably the most common current level is what we do here at Texas State, and that is the medical laboratory scientist. That's a bachelor's degree, followed by an MLS credential. And usually in these programs, the most common pathway is what we call a 2+2 program. So you do your first 2 years of general education, lots of prereqs, and then you enter our program, and our programs are very selective and competitive. For example, at Texas State, we take 20 students per year, and we sometimes have around 50-plus applications. So that's a very difficult and important process. And then there's some other 3+1 and even 4+1 where you do almost your entire degree or your entire degree, and then you go off for 1 year to like a hospital to do a full year as an internship program. In our program, a 2+2 program, in the very last 2 semesters, the students are doing a variety of clinical rotations at hospital affiliates of ours. So it just is kind of a spread along different routes to do that. Even beyond that, so those are the more traditional, and what I would say the most direct routes, I would recommend those routes to anyone that's considering our profession. Then there's the other routes, and it's actually the way I got into this profession, and that's kind of a backdoor route, which is where you have worked a number of years and you may have picked up multiple, say, higher degrees. For instance, I picked up a master's degree in virology and a PhD in a public health-related area, and I had worked for 10 years at the Department of Health in Austin and at the Centers for Disease Control. So I had to document all of that work in all areas of the lab, and then I was able to sit for my certification. So that might be a little confusing to the general public, mm-hmm. but it's also a good thing because it does allow those with maybe some amazing experiential types of education and working areas to come back to us once they find out that they only need to document some things and take those types of credentials. And then there's a whole slew of kind of specializations and categorical areas. For instance, I have a specialization in microbiology and virology that kind of sets me aside as a specialist in those areas.
Right. Yeah, so the big point here is, there's a lot of different routes. I mean, I can speak for myself as I started out in the military.
Right, absolutely.
Right, and a lot of people do that. And then I went on to get my bachelor's degree. Then I got my MPH, but I'm certified. We're going to go over certification a little bit later.
That's a great point. I'm glad you brought that up, Robert, because I kind of failed to think about that. We have multiple military veterans and others that actually go in later. There's actually an officer training protocol where you can enter our program and get support through the military to kind of finish a program and then go out and become an officer, commissioned officer as a laboratory officer. There's other, just quickly, there's some other, our profession is growing like other healthcare areas. So we've got multiple master's degrees around the country. For instance, you can become a specialist in blood banking. And most recently, we're entering a new era, really, in our profession, and that's a doctorate, a DCLS. There's several, just 2 or 3 of those in the country right now. And the most recent, these are professional clinical doctorates. So there's one at Rutgers, and the most recent one's at UTMB Galveston in my home state at Texas. And if you've ever heard of like a PharmD, a pharmacist, or a doctorate in physical therapy, a DPT, very similar. And our reasoning around these is that we hope to build what we're calling diagnostic management teams. And that's not my term. That's Dr. La Posada at UTMB. He's been working on these ideas for decades, where we will help physicians and others actually to order the correct test and kind of interpret the results correctly, and kind of being part of a holistic kind of medical rounding process for the patient. I have an entire kind of in-depth article on that in Elsevier Connect if anyone's interested in looking into that. But I think it's the next step for us, because we need to be seen by the public and the healthcare, and we need to get out actually of the laboratory and get on those rounds and help the patient that way.
Just a quick follow-up on that last point, though, Dr. Rohde. Is this a research degree like a PhD, or is it? It
is not. It is not. That's a great question. That is a clinical doctorate, so they typically will have massive specialized clinical coursework, and then they will do a full kind of resident process where they'll work in collaboration with physicians and others. And just while we're on that topic, that's an important distinction, because if you're going to typically end up in a position like mine, which is education of these future professionals, typically you're going to need to look at a PhD or other type of research-based doctorate so that you can survive in the tenure, research requirements at most major universities. Not all, but quite a few will require that, so that's always important.
Okay, and I'm talking to Dr. Rodney Rohde. He's with Texas State University. Now, we're talking about medical laboratory science, and this is a very in-demand job. However, there are big-time personnel shortages. So what is going wrong with the career field that the shortages are the way they are?
That's a great question and a big problem.
Yeah.
Let me start just real quickly by just giving you some numbers, pretty recent numbers. Nationally, there are about 2,600 MLS and 2,300 MLT students graduating each year, so roughly 4,900. But we need to fill over 9,100 job openings, so we have about a 40 to 45% vacancy rate, depending on where you look. In Texas, just speaking personally about Texas, there are about 225 MLS grads and about 200 MLT grads to fill about roughly 1,000 jobs. So we're leaving about 57% of those jobs unfilled. So it is a critical problem, and that's one of the reasons I'm excited I'm getting to talk to you today about it. I'm not sure I or my colleagues would agree with, I guess, the statement of something going wrong. but something is going on. And I think, it's really complex. It's not really one thing. Certainly retirements are a big issue, as in many industries. In fact, if I back up just a second and talk about our program, my former chair, Professor Dave Fleur, started this program in '74, and he chaired it for over 30 years. He's an amazing mentor and colleague. In fact, we call him the godfather of CLS around the shop here. But he is stepping back out into regular faculty. That's why I became the chair in 2013. And there are more and more like him. I mean, they're truly around the country. You'll look in most of the faculty. Just like in the trenches of healthcare, there are people that are becoming more seasoned veterans and looking to retire. So that's part of it. That's definitely part of it. But it's more than that. It's really kind of an upstream and downstream problem around recognition and awareness. And let me share just kind of a quick story, if you don't mind. I actually just talked about this in a TED talk that I discussed this problem. And if you would think about, and Robert, you might be able to relate to this because I talk to people that are science majors about this, but if you think back to high school or maybe junior high, and you were surrounded by maybe some friends or maybe yourself that was just really kind of a lab rat, or someone who loved math and science, maybe just like solving problems, and when they got to be a senior in high school or maybe before, and they went to visit an advisor or someone else, they probably didn't talk to them about medical laboratory science. But I would bet they talked to them about becoming an engineer, going to med school, being a pharmacist, maybe majoring in biochemistry. And really, that's part of the upstream problem, is just not knowing about the major at the level of telling students. Then, when you kind of compound that with the downstream problem of when we are actually professionals working in the field, people just don't see us. And one of the metaphors I like to use is the airline industry. So if you think about the pilot and the flight attendant and the ticket taker, these are the people you see in the airline industry. People know about these jobs, but you don't see. You might think about the doctor and the nurse as being that pilot and that flight attendant, right, and so forth, but you don't think about the ground crew, the mechanics, those kind of behind the scenes, and that's really what medical laboratory professionals are, and probably some others, like public health laboratory folks. We are truly the ground crew of the healthcare scene, and no one understands that unless they have a family member that has worked in the field, or perhaps they just were fortunate enough to have somebody like me come and talk to their high school class or something like that, which many of my faculty and students do. But it's a slow process. And then on top of that is training. Training these laboratory personnel is a very expensive process. There's few scholarship or loan programs out there for these types of fields. There's lots of money for doctors, nurses, and other healthcare, but we're, again, kind of not understood, and that's something we are working on with our legislators at all times, both at the state and national level, and with other individuals, and with our own administration and universities, because that can be dangerous when you're expensive and you're small. So it's critical that we get this word out and start educating people.
Right. All right. Well, Dr. Rohde, I got about 10 seconds left till the hard break. I hope you hang on for the second half. And again, I want to encourage you to check out the website. It's outbreaknewstoday.com, outbreaknewstoday.com. And after the break, we'll be back with Dr. Rodney Rohde, and we'll be talking about medical laboratory science.
Welcome back to Outbreak News This Week, your source for all the news about worms and germs. Here's your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, welcome back to the program. Today I have the privilege of talking to Dr. Rodney Rohde. He's a professor and program chair for the Clinical Laboratory Science Program at Texas State University in San Marcos, Texas. And to continue our discussion, let's go ahead and go into a little bit more about some of the issues, the current issues with the medical laboratory science career field. And Dr. Rohde, you said you didn't really agree with the way I said the question about what is going wrong with this career field. And I guess part of my point is throughout my 30 odd years in the laboratory field, I've seen a lot of people leave. A lot.
Absolutely.
And a lot of it has to do with my next topic is salaries.
Right.
So people are leaving because
that's part of it.
Yeah, they can find something else with less stress.
Absolutely.
And so,
I do appreciate that statement. Don't take that wrong.
No, I didn't.
It is definitely, a troubling and problematic thing for us when we are talking to future professionals, and they can look across the way and see a physician's assistant, for instance, or nursing or things like that may make 1.5 or 2 times their salary.
Exactly.
So salaries are a problem, and we can address that a little bit.
Yeah, I mean, are there certain parts of the country where I assume the West Coast and the Northeast are probably
right, and that's exactly what I was going to lead off with.
Okay,
you are certainly familiar with that, I'm sure. I mean, it's a tough question because, again, depending on the area and really what you're doing in the lab, it can change. For instance, if you have a generalist that's proficient and competent in all areas like an MLS or an MLT would be, and you put them in a high-impact trauma center and they're working in somewhere, some major city, they can push $70,000, $80,000 a year. And then, of course, you can really help yourself in our profession by, the opportunity to work shift differentials and holidays and weekends. I mean, you can push that high with that factor and experience and supervision. But what's frustrating, obviously, is some people can start at that level with other degrees. Yeah. So, again, I and my colleagues certainly are frustrated with that. I mean, I don't think anybody would turn down money if we could get a better salary. It's just that, again, I think it's tied to this unknown of who we are, and then also some of the issues around the variety of certification and licensure issues that we don't have. And so that creates, again, some problems for us when it comes to hiring and our ability to limit others from working in our field that perhaps don't have the correct background and credentials.
Now, another issue that we're having with personnel shortages in the clinical laboratory field is colleges that are providing this type of education. Are we still losing MLS programs in colleges and universities?
I actually did a little research because I wasn't quite sure, because I've been in this part of the academic medical lab area for about 15 years now. But looking back historically, I mean, they definitely dropped back from the 80s into the 90s from 600-700 programs across the country down into the 200 to 300 level. If you look across the country, we have stabilized pretty well over the last, I'd say, 5 or 6 years. We've kind of kept that level. In Texas, we're very fortunate. We have about 14 accredited bachelor-level MLS programs, and we have about 20 associate-level MLT programs. And really, we have a lot more programs in similarly sized states of California and Florida, for instance. But it is a problem. Funding's an issue for educational programs. I mentioned earlier, it's not just a scholarship issue. It's funding for programs. Keeping us running can be an expensive process, especially when you think about those numbers I told you. So if you're only graduating, 15 to 20 students a year, and then you throw in what it costs to truly train people. And remember, we're trying to get students ready for the real world of healthcare in the laboratory, so you need a certain type of laboratory and a certain type of reagent and consumable budget to run that type of program, so that can be problematic. Recently, the one that I know of in Texas, University of Texas Southwestern, actually lost the most recent program in Texas. So it still happens. That wasn't very long ago, a couple of years ago. So it does still happen, and it's a concern.
Well, I mean, maybe that is also tied into, as you were talking about earlier, about like high school career advisors not even introducing this type of education. So, I mean, who's gonna apply for these schools if they don't even know about them? Right.
I mean, it's really a double-edged sword.
Yeah.
And we're again looking and listening, and social media has become a huge leveraging tool for myself and others in the field. We're trying to get more in balance with what the new student of today is looking at and utilizing for majors. We're trying to show one of the things that I didn't mention earlier that, I'm sure you would agree, is that this major is an amazing foundational degree. I mean, you can take this degree and do so many careers,
yes.
Not just a healthcare hospital lab. You can pick up an MPH like yourself or other things and end up at the Centers for Disease Control or other types of laboratories like that, or you can venture into the corporate world, go into education, and it's portable. So there are some unique and attractive features. You can work anywhere in the country, if not around the world. You are not competing generally with, a million biology degree majors that sometimes are coming back to get a post-bac degree with us because they can't find a job.
Right.
And that's a selling point for us. I mean, Texas State, and all my colleagues, I mean, we have 95 to 98% employment rates within 2 months of graduation. Many of our students go on to pick up advanced degrees, and they're very competitive with fellowships and internships. But it is a problem because on the backside of that, they leave our field to move into other areas that pay more. So it does come back to sometimes that salary, and that's one we're keenly aware of, and we're looking for ways to change that.
Yeah. Well, I mean, that's clearly something that should be emphasized, is how marketable it really is. I mean, you get this degree, you're going to get a job.
Right. I mean, that's a great selling factor with mom and dad when they're sitting across the desk from me, and I talk about, one of my kind of jokes but serious comments to parents is that, if your child is not working after our degree, it's because they just don't want to work, because there are so many jobs, and usually they're being asked to work before they even graduate. So it's not a problem as far as job.
Okay. Well, last question concerning personnel shortages is, I know some countries, particularly the Middle East countries, some European countries,
right, they
really recruit a lot of medical laboratory scientists from other countries. The U.S. used to do, I'm not sure if they do anymore. Now, these are very qualified medical laboratory scientists. I worked in the laboratory in the Philippines for 5 years.
Okay.
And these we called them technologists back then. They were fantastic. And,
absolutely.
And they're peppered all throughout the Middle East working. Now, is this, what's your thoughts on this as either a temporary or a permanent fix for personnel shortages here?
I think it's here already. I mean,
okay.
I'm certainly not an expert on international agencies and oversee employment figures, but I think like nursing and some of these other areas, we share that truth. I mean, I think most of us that work in the field and educate and work with our legislative process and things like that, as long as those individuals are properly educated and credentialed. In fact, now we have I know ASCP, which is one of our major certification agencies, they have an international certification for people to pick that up. And so as long as that's going on, I think we're going to continue to see that, and we're probably going to need it to help out as we kind of try to bridge this gap between retirements and awareness and salary issues within our own country, and just, trying to find ways to grow them from within would be my goal. But
of course.
But it's a global community, so we'll do what we have to do.
Well, it's just interesting because I do talk to some people that live overseas or were trained overseas, and
Sure.
They find it so much easier to find a job in Canada. There's less restrictions and less,
Right.
and I don't know if things changed after 9/11. I don't know what changed, but it seems like it became more difficult. So Canada is now a place that people go to, to find work. Mm-hmm. Anyway, that's just a sidebar.
That's an interesting comment. If I had my former chair, he'd probably be able to talk for hours about that.
Yeah.
He's got a nice 40-year perspective on it.
Okay, let's switch gears and talk. There's a certification, which is a voluntary test that you take with an organization, a professional organization, correct, to prove competence. And there's several of them. And you already talked about the ASCP, the American
right.
Society for Clinical Pathology. I hope I said that right. And there's some other ones. And
correct.
Dr. Rohde, what is certification? Can you get a little bit more detail than I did? And there's several. The thing that's odd about it is there's several accrediting bodies, and are they substantially different in any way?
Not totally, but there are some differences. And before I totally try to do this, it is another kind of, I think, confusing area for our profession, which is probably some of the headaches we have as far as getting understood. And we know that, so we're always trying to figure this out.
Mm-hmm.
But I've actually written some articles about this in different arenas around just what our major is and what licensing versus certification means. So those articles are out there for those of you who want to really peek at the details. But I guess I should start by saying that as a profession, and I can speak for my colleagues that I work with, we're really passionate that our graduates become certified and or licensed. We think it's very important and very critical. And while it is voluntary, unfortunately, I would say, in my opinion, it's basically not. If you talk to most hospital settings and most out in the country, they are going to always hire and advertise for a certified and or licensed medical laboratory professional. And often, and I know you know this, but when I talk to the lay public, I will ask them, would you want a job as critically important as ours to be conducted by, a high school graduate with very little clinical training, or even someone with a degree that has no clinical education or have worked in the trenches of lab medicine to kind of understand what that means? And it's a very sensitive topic before I get into the agencies, because I always tell this with people. I am one of those people. I came from a different degree and kind of came into this profession as a back route. And so I'm a big advocate of this, and so I always feel like I can talk to this piece, because I can talk to a microbiology major or a chemistry major who is trying to find a job in our field, and they don't understand why they might be looked at differently. And I always try to, help them to understand the differences in the educational piece. So it is a very difficult thing to explain sometimes. But ASCP, the American Society for Clinical Pathology, is the primary certification agency, I think, in the United States, if you asked most of my peers. Mm-hmm. There's also the American Medical Technologist, which is AMT. There's another one called the American Association for Bioanalysts, AAB. Even ASM, American Society for Microbiology, has kind of a categorical for micro people, right, the RM. So there's a lot of those, and you may be familiar with it. So we typically, in most accredited programs, typically ask our students to take the ASCP. Some will eventually do the AMT if they're looking for another experience to try a different one, for instance, if they're not successful on the ASCP. And we don't really promote ASCP. That's just the one that's typically looked at as a standard by most hospitals. Some have different requirements. Some, may not have as rigorous educational standards as ASCP, so that's kind of why we stick with that one as far as the primary one.
All right. I got about 9 minutes left. I got a lot of stuff left I wanted to talk about. So let's talk about licensure real quick. And
sure.
I live and I work in Florida, and
you're in a licensed state.
Yeah, occupational licensure. And I don't know what your views are, but I'll just give you mine real quick. I feel like I'm just funneling money to Tallahassee.
Okay.
So I have the ASCP. And that's all that's required to get the license because it reciprocates. I don't have to. So I don't really know what the benefit is other than, feeding the trough up in Tallahassee.
Right. I think I can totally relate to your statement. That's probably one of the most common things I hear. And for those out there listening, what that means is if you take the ASCP generalist exam or categorical and you're given that certification, for instance, in Texas, if I move to Florida, I pay another fee and I might do some other paperwork, and it's basically there's a reciprocity, so it becomes a license in Florida. The only different ones out there are, to my understanding, is California and New York are a little different. You might have to do some other things to make that happen. But there's really just 12 states in the United States that have licensed states. The rest are usually certification requirements, or at least hopefully they're requirements. Mm-hmm. But I think the argument that we would make, and again, we've written about this and talked about it, is really in the realm of safety with respect to what that means. And so, in our opinion, CLIA, which is kind of the benchmark, I guess, for clinical laboratory regulations, we think that's minimal. In fact, in Texas, 11 labs have been closed since 2011 because of continued deficiencies over quality testing and things like that. And it's really, I think, more about, for us, we have no way of knowing in Texas, for instance, how many people are truly working because you don't have to have a certified person. So we don't have numbers, strong, hard numbers to talk about scholarships and loans. It becomes an issue with growing programs and getting the support of those programs. So part of it's just numbers and getting data. When you have licensure, it becomes law that you have those numbers and you're registered, if that makes sense. And then the other piece of that is that in Florida, since you have a licensure, that means when someone is, for instance, has a malpractice issue or some issue with their quality, they are tracked. In Texas and other states, they literally can move to a different county or to a different hospital, and if people don't do their due diligence, there's no record. We have no way to track poorly practicing medical laboratory professionals. So it's really on the side of quality that we're looking at. Mm. And I'm not sure what Florida the payment is, but in Texas, and we're not a licensed state, but we've tried to put bills together to make that happen. It basically would be about a $50 a year type thing, which, in our mind is pennies on the dollar for what you're getting. But I do appreciate your argument and your stance on that. We've had that discussion with many, many people around, why. And I guess for us it's just a quality issue because we worry that if it doesn't happen and it continues to go the other way, that anyone can do laboratory testing. And that may be another topic. I wish we had a lot. I wish we had a lot more time to talk about this because I do have a lot of comments to make, but I'm down to about 5 minutes. So sure.
All right. Now earlier this year, the CMS, what does CMS stand for? Centers for
Medicaid.
Right.
Yeah.
They announced something that was pretty controversial in our world, that nursing degrees would be equivalent to biological science degrees. And just real quickly, Dr. Rohde, what are your thoughts on that?
Well, you may know that changed recently, so we actually were successful in stopping that process.
I did not know that. Good.
I can send you some information specifically about that, but literally within the last week or so, ASCLS and ASCP were pushing out information that initiative was stopped by our by our screaming and hollering and writing letters
Excellent.
and other things. But CMS's position was basically going to allow individuals with as little as a bachelor's degree in nursing to direct a CLIA moderate complexity laboratory and serve in a senior supervisory role within those. And based on all of our data and what we know, there's just a total difference between our degree and a nursing degree requirement. So our degrees require typically 3 to 4 more times more academic science than nursing does. Obviously, nursing will do no types of clinical laboratory work. And my ultimate argument would be that nursing is valuable. I love nurses, but I don't want them doing my laboratory work, nor would I want to set up a catheter.
Exactly.
Anyone, I'm not a nurse, I'm not a physician. So it was just I don't know if they went into it understanding exactly what kind of pushback would happen, but certainly we were happy with the outcome that stopped.
Yes, that's good news. Very good news. I got about 3 minutes left. I want to get some of your thoughts on the future. Now, technologies that moved and improved very rapidly over the years since I've been in the clinical lab. What do you see as the most important testing improvements, and what do you see as the future as far as technology? In about a minute.
Sure. I think technology is going to be a huge driving force from everything from the electronic health record to laboratory information systems, and certainly in our students and future professionals in understanding how to work within all of that. I do still think you will need individuals that are smart, sharp, and questioning about what the tests mean. As we know, automation and equipment can be wrong, and you need somebody there with a brain, with the right training and the understanding to know that there is something to worry about. But certainly we're excited about all of the automation, even in the world of microbiology that I'm in, with respect to MALDI-TOF and other types of amazing things coming along.
Okay, so let's look into your crystal ball 10 years from now. Where do you see MLS education, this as a career, and the function of your typical lab?
I think I'm hopeful, and I'm hoping it's quicker than 10 years, but I see our profession and our education moving more into kind of an entry-level master's training. I think a lot of programs are starting to look at that. It's not going to be overnight, but I think that's most of the healthcare areas have done that. I've already mentioned we've seen movement to a DCLS ultimately. I don't know if that'll be ultimately the entry level, but I do see us getting more advanced education as far as an entry level type of degree with some specialization. And I think the functioning of the typical clinical lab will be, we must grow into more of these diagnostic management types of teams where we are a critical piece, a bridge to the physician and other healthcare providers for our patients and our family members to understand what tests mean, what tests to order, and how to correctly go about doing that.
Very good. All right, Dr. Rohde, if you can, what's the website for Texas State University's program?
Sure. Our particular website is www.txstate.edu/CLS.
All right, and I'll go ahead and get that up on the website when I publish the podcast. And I want to thank you, Dr. Rodney Rohde, for your time and expertise, and I hope to have you on in the near future to talk about some other really interesting topics. I appreciate it so much.
Robert, I certainly appreciate it. I know you've had a lovely chance to talk to my friend and colleague Pam Wilson about rabies. Yes, and
I appreciate you for hooking that up.
Oh, absolutely. And I hope we can talk in the future more about actually some infectious disease topics. I would love to do that too.
Definitely. Thank you, Dr. Rohde. Have a wonderful Christmas.
You too. Have a great holiday.
Okay. Well, that's the show. And I want to thank my guest, Dr. Rodney Rohde, and I will see you next week on Outbreak News This Week. Good night, and God bless.
Thank you for listening to Outbreak News This Week with Robert Harriman. If you missed any part of today's program, you can listen to the podcast anytime on our website, outbreaknewstoday.com. Make sure to join us here next week for Outbreak News This Week with Robert Harriman.